Today's episode is going to be beyond fantastic, as it will showcase the attributes of a very talented individual who has devoted her life's work not only in the field of advanced practice in nursing, but to the care, support, and advocacy to break down racial barriers and make better the quality of life of persons living with sickle cell disease. See, she is all things sickle cell. I love that she refers to herself as a classical hematology nurse practitioner. I want to delve in deeper into that and on the show today and move importantly for warriors like me who often struggle with receiving personalized care in this intricate area of sickle cell disease. She is a superpower healthcare provider. Please welcome classical hematology nurse practitioner, a social media extraordinaire for SCD, and an advocate for sickle cell. Please welcome Miss Maya Bloomberg. Maya,
What's up?
how you doing?
I'm great. I'm excited to be here. Thanks so much for having me.
No, thank you for being here because you know what? I follow you, and I'm telling you, I love the way you do what you do. The information and the way you get it out to the public about sickle cell disease is different than anything I've ever seen on social media. Most people sit around and just talk, right? They'll just talk about it. You make it fun with videos. I mean, the crazy stuff you do. You really don't take yourself that serious. I can tell that. But I have to know this. Talk to me and let me know what does this mean? A classical hematology nurse practitioner. What does that mean?
Sure. So for those who aren't aware, hematology essentially focuses on studying and treating different blood disorders. And that can be broken down into malignant, which is going to be your blood disorders that are cancerous or neoplastic, like leukemia, lymphoma, or myeloma. And then you have classical, which is your non-cancerous blood disorders like anemia, clotting, platelet disorders, and hemoglobinopathies, which sickle cell falls into. So it used to be referred to as benign hematology, but what's so benign about sickle cell and clotting disorders in your brain, et cetera. So more recently, we've adopted classical hematology. So it might not be the exciting answer, but that is the new term for benign hematology.
So then when you pick this up, how did you know? So I'm gonna go on social media and do this, Mike. What made you pick that platform up and says I'm going to talk about sickle cell, and how you come to that? Because it's not very many people like yourself.
Yeah, so I fell into sickle cell. I started my nursing career as a bedside nurse on a med-surg tele floor, and I took care of countless sickle cell warriors. But when you're inside the hospital, you really only focus on the pain and anemia. And I really didn't learn everything I learned about sickle cell until becoming a nurse practitioner and seeing on the outpatient side how it truly encompasses head to toe. But when I was a bedside nurse, I saw some great doctors, but I also saw some not so great doctors who treated patients like numbers. So when I became a nurse practitioner, I actually was more concerned about the provider I was going to be working with as opposed to the specialty. So I turned down a couple jobs. I met Dr. Harrington, who anybody who knows him, his energy is magnetic, and he is one of the exceptions of the doctors who truly cares and puts the patient first. So I fell into hematology, but I think that was divine intervention. And my social media advocacy, it really started during the pandemic. There was so much misinformation out there, and patients were believing things that they were reading in Facebook groups more than what we were talking in the doctor's office. And I figured if this is happening with my patients, this is probably happening all over the country. So I went to art school for 8 years growing up. I'm such a creative person, but in the medical field, I never really got to use that creative side of my brain. So I saw a problem. My solution was going to social media, since so many people are just glued to their phones and just mindlessly scrolling. And content creation and sickle cell was a beautiful marriage.
Yeah, because I look at what you do and the way you do it. Would you say that all the things that you create, the goal is to just make sure you get the right information, like everything that you're creating? I know we may see you doing all the crazy stuff, but when you be pointing and you're doing this and you're doing that and yeah, all that stuff, I'm following the finger. I said, oh my gosh, I've learned, and so the things that you see in the sickle cell field, what do you see that really should change first off?
Oh my God, that's a loaded question. So much should change. But I think the bottom line is at the end of the day, a patient is their biggest advocate. you can have a great provider, but still, my goal is to really empower patients to be their biggest advocates. We know that there's a shortage of sickle cell providers across the entire country, and especially on the adult side. We've made a lot of advancements in the pediatric side with regards to life expectancy and newborn screening and early diagnosis and penicillin prophylaxis, which helped improve life expectancy. But unfortunately, it wasn't as powerful through the adult side. So the shortage of sickle cell providers really, I think, is something that negatively impacts the health outcomes and what contributes to the health and racial disparity that we see with this condition. And we know that knowledge is power. So if you're connected with a provider who's only viewing sickle cell for pain and anemia, you're not going to receive that comprehensive type of care that we truly need for sickle cell. So I hope that my page allows patients to get the information that they need in an easy to understand way to ultimately lead to more meaningful conversations with providers. And again, so you can know what those subtle changes or what signs might be a red flag and warrant going to your doctor for a sooner visit, and just different ways that we can make you live not only a longer life, but a good quality life with sickle cell.
That, and you know what? I think that that's probably, if I can imagine, if you were my hematologist, I feel like you have so much compassion for your patients. It's not just you're just going to be their hematologist. Like you're gonna actually be their friend too. And you know, when your friend is down, you get down in the trenches with your friend. I mean, is that true about your practice? How do you and your patients interact?
Yeah, I mean, it was very interesting because in the beginning, when I first started, obviously as a white provider, you have to earn your trust. There's already such a mistrust among the sickle cell population. But I think once people realize that my heart is pure and I really put the patient first and I view a patient provider as a relationship and a partnership as opposed to me just telling you what to do, it was obvious that I really am compassionate and empathetic. And I wish it was universal. I don't think that we can teach compassion or teach empathy, but I tried to spread more awareness for sickle cell because I think my compassion went to the next level once I understood that sickle cell is so much more than pain and anemia. So I think being able to just amplify the voices and humanize the sickle cell experience can hopefully help bring some more compassion.
Do you feel that, because you said that? Let's just talk about that. You, because you said that being a white hematologist, did you feel like there was some distrust in the beginning when you started?
There was definitely a handful of patients who would not see me. They said, "Nope, I want Dr.
Nuh-uh.
Harrington," and but it's okay. Honestly, I never take things personally, and I use it as a reason for me to like work and prove even harder that my intentions are good. So I kind of view it as a competition. Like, okay, you feel this way about me, and I think when somebody has a misinterpretation or they view me in an incorrect light, it almost makes me want to just prove who I really am to them. So I did have patients who in the beginning didn't want to see me, but very quickly realized that I'm their go-to gal. And I think,
Yeah, it's like, give me Dr. Bloomberg, please. Can we get Dr. Bloomberg? Like it's like a lion now, you know. And for your practice, like, what is the mission for your practice when it comes to sickle cell disease, or your goal for your patients, and even your practice? What do you want the world to know about this?
I think the biggest thing is that we really have to understand the delicate nature of this disorder. I think it is a very misunderstood condition, and as a result, we have worse health outcomes. It doesn't bring in a lot of money like cancer does, so providers might not necessarily be as interested or incentivized to see this population. So when I treat my patients, whether it's sickle cell or any condition, I truly believe that patient provider is a partnership. And I think shared decision making and just involving patients in their experience is what the standard should be when we're treating patients. Because unless we have something that says this is the best treatment and is taking the assumption that the provider knows everything, we need to have a more two-way kind of conversation and involve the patient in it. Because I always say I only learned so much about sickle cell in school. I really learned everything through my patients and their experiences and firsthand. So I would say my mission and just my approach to patient care is involving the patients. And instead of just saying, you need to do this, explain the why behind it. Because when patients understand why we're recommending something, they're so much more likely to actually adhere to the recommendations, which then will improve their health as well.
Yes, because I think about, like, like myself, like, we have to go through so much, as a sickle cell patient, including my own life. I mean, I've
Mhm.
had it to where I've been mistreated. I've had all these long waits in the waiting room, and been dismissed. And when I do get a bed in the emergency room, all of those things do happen, because now we're getting into, you're affecting a patient's mental. We got the physical. But the distrust came when I come to the emergency room and you dismiss me, and then you take time just seeing me, and now I have to focus on, am I as valuable as anybody else?
Yeah, it's major. I mean, the psychological impact of sickle cell we cannot be overstated.
Can I ask you something?
Let's
I'm
see.
gonna ask you this because this is important because we all know what the physical pain that comes with sickle cell, and but we don't discuss enough about the mental portion of it, and people suffer with sickle cell because of the way they're treated.
Hmm.
I mean mentally. I just hate that fact that you got to see that. And what is your take on? Did we talk about the mental enough? Do you see that with your patients? Do you discuss that with them?
100%. I mean, the psychological impact of sickle cell cannot be understated. And we know that negative mental health will negatively impact your physical health. So, this is something that I do address in every single visit to make sure that we're screening for depression and anxiety. We talked about how this condition can cause physical pain, but it's important to realize that while we know there are certain triggers to developing these vaso-occlusive crises or these sudden acute pain crises, you can also be doing everything right and still develop a crisis. So knowing that is very heavy and can negatively impact a patient's psyche. I think another big thing is, again, like you had mentioned, is having to combat with the physical pain, but also having to combat negative judgments and attitudes of providers who just don't understand sickle cell or who have implicit biases that interfere with the person receiving the appropriate treatment. There's also that problem where providers or warriors are being told that they're not going to be living, or they won't live, excuse me, beyond a certain age, or know of different warriors who passed away too soon. And that can be really heavy to have in the back of your mind. So unfortunately, we do see depression and anxiety quite common among this population. And that again will worsen the sickle cell pain.
Yeah, because I'm not exempt either. Because it is very hard. Growing up, and your parents. I was diagnosed at 7 years old, and the provider told my parents, "Hey, don't even plan a life for him. He's not gonna make it past 11." And so, and growing up, every time I had a sickle cell crisis, I thought that was just the end. I always believed that part to be like, okay, well, this is it for me, because they said I'm already 15. I'm 4 years overdue. And so, you want to do other things every other kid does, and they tell you can't do that. And you see all the other kids out there doing it, and you're trying to figure out why I can't. You won't even let me try. That's the sad part. You won't even let me try it. I can shoot a basketball. They're shooting a basketball. How hard can this be? Well, you have sickle cell or anything like that. So, understanding who you are and understanding that, hey, man, I don't want the mental to be out there for any person with sickle cell disease. You have to understand that you are very much stronger than what they tell you, because they're going to tell you a lot of things, and they're going to tell you a lot of things you can't do in life. But are you able to speak to some of these situations that you've seen personally in your practice?
I mean, I try to let my patients live as quality and enhance of a life as possible without having to be restricted by their sickle cell. I mean, I have some sickle cell patients who are flight attendants, which granted, it wasn't the best.
Ah,
I know it wasn't
what?
a very eager profession for our patients, but it just shows that it is possible. We did certain testing and different things to just make us feel comfortable signing her off medically for this type of position. So it is important to try to control what you can control, because I think we're talking about the mental impact of sickle cell and you're being told that you're not going to live beyond a certain age. You think for the patient, what type of impact does it have on you? And just the isolation and the fears. I mean, that is a form of mental trauma. But then also for the parent, that's going to cause so much trauma as well for them, because you have that feeling of helpless of, I can't help my child. It's just an awful feeling. So I think I always tell my patients, focus on the factors that you can control. So unfortunately, that does mean that playing basketball, if that is a trigger for you, that's something that you want to do more smart. So we want to identify what your triggers are and avoid those triggers. So if you were my patient, I'd be like, you know what, you want to play basketball, let's find out ways to do it safely. So you want to stretch before to warm up your body. You want to stretch afterward to cool down your body, break up that lactic acid. Drink throughout. If you were to develop pain at any point in time, you want to stop and realize that you can't just expect to run a marathon overnight. You have to build up the endurance to get your body ready. So I think there's ways to work within the limitations. It's just a matter of having an open dialogue with your provider and letting them know what are some of your goals and values and preferences and what you want to accomplish, so we can try to work with you and find the safest way to do that.
Yeah, because that mental health part is absolutely real and is valid to the success of that patient. I know that when I even though if I'm in a hospital and I know that I'm getting the care that I need, I feel like I want to get out. I feel that way. But when you withhold my pain medicine and you tell me it's going to be here at a certain time, and then I don't get it for 2 hours later, then I feel like I'm being set up to lose.
Yeah, and it's crazy because there's a study that showed that I think it was 67% of warriors reported staying home to treat a sickle cell crisis, even though they knew that hospitalization more than likely was required. And it's because they want to avoid the judgments and the mistreatment from these doubting and dismissive providers. So then you think they finally decide, okay, my pain is severe enough, I can't control it at home. They go to the emergency room then because they finally put pride aside and realize they need help. But then they're met with resistance by these doubting providers saying that they don't look like they're in pain, or their labs are normal, they must not be in severe pain. And that mental stress is then going to already exacerbate the pain. And then again, you mentioned how there's delays in treatment. We have studies that confirm that patients with sickle cell have delays in receiving their medication compared to different diagnoses. And oftentimes it's an inadequate dose. So we're making patients wait longer for their pain medication. We're giving them doses that aren't adequate or enough to actually relieve the pain. Then we're adding more stress on top of it, trying to question them and doubt that they're actually in pain, which is then going to worsen the pain and make it even harder to treat altogether. So it's really this vicious cycle of trying to get somebody's pain under control. And unfortunately, some of the healthcare providers are causing more of that pain or exacerbation of pain.
Yeah, because that was me. I'm in the 67%. I've
I
done
believe
that.
it. A lot of my patients are too.
Yeah, I have stayed home and said I'd rather just hope this passes than go in here and deal with the treatment I'll get in the hospital. And that's sad to say, but that's
It
the
is.
absolute truth. That's the absolute truth because it's not just being at home; it's getting there and going through the emergency room process. So, I want to just ask you, Dr. Bloomberg, what would you do to challenge other healthcare providers in the admission process? Like when you hear there's a sickle cell patient in here, and then somebody comes in with a broken arm and they leave and they go in before me, and I'm sitting there with a level 10 pain, and then because I don't look like it, and I know my pain chart, and I'm sitting there saying, when they say what's your pain level, I say 10, they think I'm out here trying to do something like to seek drugs or something like that.
No, and the reality is I believe I saw a study. It's like less than 10% of patients actually will develop a substance use disorder or an addiction. But when you look at the way pain is treated in the hospital, you would think that the percentage is so much higher, because it's almost like providers are trying to find the person who's misusing, when in reality, it's such a small fraction. There's a lot of issues when it comes to the flow of the emergency room. We have guidelines, sickle cell guidelines, and it actually states that the standard should be that you should get your first dose of pain medication 60 minutes from the time you register in the emergency room, or 30 minutes from the time you reach triage. And unfortunately, that doesn't happen. And even in my hospital, that's not happening. We're doing a QI, or a quality improvement project, to help improve the emergency room flow, because we saw only like a quarter of patients were
Hold
actually
on,
meeting
wait
that
a minute.
benchmark.
Hold on, Dr. Bloomberg. Did you say within 60 minutes of me getting there, I'm supposed to get some pain meds?
Mm-hmm.
And then if I get to the triage, 30 minutes after that?
That's what's supposed to happen, but we know it's not the case. So
That
we're
has
trying.
never happened.
I know. We should be doing polling for everybody to see how often that happens. And people
Ah,
don't even realize that guidelines exist for sickle cell, and that we have outlines on how to treat sickle cell beyond the pain, and how to screen for different complications, and what the typical protocol should be in the emergency room and hospital setting. But it's not being done. So this is where the lack of awareness is. This is where providers really need to do some self-reflection on their implicit bias. There is an implicit bias test by Harvard that I had put on for free, and I just decided to take it, and it showed that I had a slight preference towards Caucasian faces. And it kind of bothered me. I mean, I guess it makes sense, because if you're raised in I'm raised in my Jewish bubble, but I went to college, and that's kind of when I expanded my whole worldview, et cetera. But it made me realize I'm such a strong sickle cell advocate, and even I have some tendency or preference towards a different ethnicity, that it gave me another level of awareness for me to be even more mindful when I'm caring for patients, and questioning myself, like, okay, if I have any questions or narrative in my head, I try to eliminate that and really just talk to the patients and believe what they say, because it's important to realize that patients have families, they have their job, they have their friends, they have their social life. Most patients do not want to be in the hospital, and again, are doing whatever they can to avoid being in the hospital. So the fact that they're actually sitting in the emergency room, a provider should assume that they've already exhausted the list from top to bottom of different management strategies that would have avoided the emergency room to begin with. So I think it's really hard. We're looking though at our institution about the flow of the emergency room and trying to see where the biggest delay is from the registration process to that time of first pain medication to try to improve it at our institution. I think for patients, though, they can, one thing, I mean, we should try to avoid the hospital at all costs. So this is where making sure that you stay on top of your outpatient appointment, get connected with a sickle cell provider so we can try treatments and whatnot to keep you out of the hospital altogether. But then if you are having it, some places have infusion centers. So I have the ability to bring my patient to come in outpatient for IV fluids and pain medication. I can do blood transfusions outpatient. So I think this is where getting connected with a comprehensive center and having a good relationship with your provider, hopefully we can do what we can to avoid the hospitalization in the first place. But if you're at the hospital and you're not getting good care, I usually will try to call the hospital, because I think when the ER doctor knows that you're actually followed by a hematologist outpatient, sometimes they do treat differently, because unfortunately there are patients who just go from one hospital to the next to the next. They do not have an established hematologist outpatient. So they're not really getting sickle cell care beyond the emergency room visits and hospitalization. So sometimes making sure the ER doctor knows, like, hey, they're already established in our center, this is what works for them, can help. But it's hard because, I mean, I'm sure you can speak to this better than me, but you've lived with sickle cell your entire life. You know what works best for you. You know what pain medication works best for you. But then when you go and tell the doctor, oh, the Dilaudid is what works best, then all of a sudden you're labeled as a drug seeker. So it's like a catch-22,
yeah,
because
it
you
is.
try to advocate for yourself and stand up for what's right, but then you end up being labeled as being a difficult patient or a drug seeker. And it's just, it almost feels like a lose-lose situation. But that's why getting connected with hematologists and nurse practitioners and comprehensive sickle cell centers, we can at least take some of that stress and try to advocate for you. But unfortunately, it's not always going to work.
Have you ever felt helpless with a sickle cell patient? And if you can, just give an example. If you felt like you've done everything you can and they still failed the patient.
Yeah, it's hard when I have patients who are admitted outside of my hospital. I don't have privileges at outside hospitals. So anytime somebody's admitted there, I can do my best to try to speak to their providers and explain to them what the course of treatments are and whatnot. But a lot of times they don't listen. So I think it's a very helpless state when you see a patient who is not getting the treatment that they need, and just understanding that every single sickle cell crisis matters, because unfortunately it only takes one to lead to premature mortality. So I think we just really need to keep advocating. And from a patient standpoint, if you feel like something isn't right or something doesn't feel right, keep pushing on, because you know your body best. And a lot of times that's the thing that can really save you from having a worse outcome.
Yes, and I'm telling you that is that I know I've had hematologists, and that's important that we do go into our system and don't try to go to an outside hospital, because it is a lot easier for the doctor to treat you, even if you're in the emergency room, if you're in your care of your own hospital system. I have made that mistake, was because sometimes I've had sickle cell while I'm out of town, while I'm on the road.
How dare you?
Yeah, I mean, I can't do it. And then
Yeah.
even then, they thought I was lying then.
Mm.
They thought I flew all the way down here just to go get some Dilaudid. I I don't even understand. I said, does this not sound crazy? It sounds crazy for me to fly all the way down here, do my job. I end up getting a sickle cell crisis, and I come into this hospital and says, well, he's only here for drugs.
Yeah,
And
it
that's
sounds crazy, but it happens, unfortunately. Like, we'll have patients come to our emergency room and they have the most elaborate stories. They'll say that they follow by this hematologist who's a very well-known hematologist in sickle cell. And then you do an electrophoresis and you come to find they don't even have sickle cell trait. So it's very frustrating. Like, unfortunately, we have a whole list of people who fake having sickle cell, and you would think, who would want to ever fake about having sickle cell? But unfortunately, it does happen. And it's very frustrating when we have another name put on that list, because that is the list that is unfortunately negatively impacting the majority of my patients, the majority of sickle cell warriors in the entire country, because there are some people who unfortunately they do have a psychological disorder. You have a psychological craving. There's physical dependence, where with sickle cell, you have a chronic condition that causes chronic pain. You're going to need narcotics to treat said pain. And over time, living decades and decades with sickle cell, we're going to have to raise your narcotic dose because tolerance happens, where a lower dosage you don't respond to anymore because you've been taking it for all of these years. So while we see tolerance happening, addiction is very rare. But it's very unfortunate when we're seeing patients being mislabeled as drug seekers, when in reality they have a condition that's going to require narcotics their entire life. So we have to have that understanding and realize that tolerance can happen, instead of automatically just assuming that somebody is trying to misuse such treatment.
Right. Yeah, because I know we've covered so many different things. I mean, we've covered the physical, we've covered the mental, we've talked about all the things that happen in the emergency room. But let's get to the thing that I like talking about, the impact you make, the empowering you do. I mean, talk to us about some self-care tips we can use for sickle cell patients as myself, or, talk to us about how we can have a better quality of life.
Sure.
Just give us some things that you've seen that works.
I would say the biggest thing is stay on top of your screening test, because at the end of the day, a screening test is what allows us to identify a problem early before it actually becomes a problem. And that's what's going to lead to the best outcomes. So we know, I always say, anywhere blood travels, sickle cell can affect. And that's why we see literally head to toe complications. So you should be getting annual full dilated eye exams starting at age 10, because sickle cell can actually cause blindness. But it's not like it just happens overnight. This happens progressively over the years. So if you get an annual eye exam, they could see some of these vessels that are at higher risk for bleeding and laser them away before you even have that potential for having a bleed and losing vision. We know sickle cell can affect your kidneys, for example. So getting your blood tests and lab work, specifically a urine protein level, can help pick up one of the earliest signs of kidney involvement, so we can start on medication or be more proactive with your care. So I would say the screening tests are the most important thing. Staying hydrated is obviously a no-brainer. I feel like that's always number one, because dehydration is the number one trigger for sickle cell crises, but it can also cause an acute kidney injury. You have sickle cell, which can damage your kidneys on top of it. So dehydration can be a double whammy for patients with sickle cell. And then I would focus on stress management and your mental health. I think so many times people think that they're their own unicorn and the only one who are dealing with difficult things, but unfortunately is much more common. I think the rates were over 35% of individuals with sickle cell can have depression, and around 15 to 20% have anxiety. And knowing that this can negatively impact your physical health, I think it's really important to first have the awareness. If you do find yourself just struggling a little bit more, this could be just a matter of connecting with advocacy groups who have different support groups, and connecting with other warriors who've been down a similar path, maybe actually seeing a professional. I mean, my therapist is my godsend. I feel like I'm a huge advocate and promoter. I think there's a lot of stigma associated with addressing your mental health, but stress is a trigger for sickle cell crises too. And I think if we can learn,
Yeah, I'm just raising my hand for every time you say something. Oh, that's me. I just
literally.
identifying myself. That's all.
No, it's so true. So I think just making patients realize that and learn to set boundaries, learning to ask for help, learning to say no. There's just so many ways that we can just learn to work within our limitations. So I'd say fluids is number one. Number two is staying on top of your screening exams. And number three is just realize the importance and value of addressing your mental health.
You know what, Maya? I thank you so much for coming on here today. I really do. I appreciate everything you're doing and everything you keep doing. You are a shining example of living your life, because that's exactly what you're doing, helping all these sickle cell patients. So before we get out of here, can you let everybody know where they can find you, Maya, on social media?
Sure. I'm the Heme NP, like hematology nurse practitioner. So I do most of my stuff on Instagram, but I have it cross-posted on Twitter, Instagram, TikTok, all that fun stuff.
Well, you're the best hematologist I've talked to.
You're so
I
sweet.
sure appreciate. I appreciate everything you've done. You've done a fantastic job. Thank you for coming on, living your life. We appreciate you so much, and I'm telling you, I really enjoyed talking to you, Ms.
Likewise.
Dr. Bloomberg. All right, that's our show for today, people. Ladies and gentlemen, round of applause for Dr. Maya Bloomberg. You did that. You did that.
Should I do my twinkling fingers now too?
Yes. Thank you so much.